Ladies and gentlemen, can I please have your attention? All those waiting by the graduates, can you please move towards the center aisle so the graduates can go out from the bleachers? Thank you. Once again, can we have all the guests please move away from the graduates so all the graduates can move out from the bleachers? Thank you very much. And can we have all the students please exit towards the back of the parking lot? Please exit and go outside the way you came in towards the back of the parking lot. Thank you.
Greetings, everyone. First of all, I just want to say I think Mary Breckenridge would be really, really proud today. Second, I want to invite you all to sit down and relax and get comfortable. So my name is Susan Stone, and I am the proud president of Frontier Nursing University, and I want to welcome all of you here today. And I want to welcome especially our graduates, but also the families, friends, staff, faculty, and guests who are here. It gives me great pleasure to welcome you to the 2018 commencement ceremony for Frontier Nursing University. To our graduates, I offer my heartfelt congratulations. You made it through all those hours of study, the time away from your family and friends, your clinic visits, all those long nights on call, waiting for babies. You did it. Today, you have arrived. It's your day today, and I hope you enjoy every minute. I think that when you look back on this day and years ahead, you'll realize it was a great turning point in your life. So you have arrived, but the journey isn't over, it's just beginning. From here, you are embarking on a new career, and it's a really most worthy career, one that is so vital to our communities. And because of your hard work and study, you now have the knowledge and skills to assist you in making a difference, not only for the families you serve, but all for improving the delivery of quality health care across America and around the world. When I think about you, I think just the fact of you being here speaks volumes about you. As we all know, you were all nurses when you came here. You didn't need a career. You didn't need a way to make a living. You already had that. But you were on a mission. You chose to do this because you wanted to better serve and make a difference for the families that you care for. You chose to join the legendary force of Frontier warriors, healers, teachers, researchers, and visionaries who've gone before you. And yes, you've arrived because you chose to answer your callings for the profession of midwifery and advanced practice nursing. But we all know you did not make that journey alone. You made it to this day with the support of your friends and families. And to those family members and friends who are here today, we offer our sincere gratitude for your support and for your sacrifices that you made during the endless hours that today's graduates spent studying, making trips to Kentucky, being on call. Be it the missed soccer games, the birthday parties, or the family reunions, these graduates depended on you to fill in the gaps in their everyday lives while they pursued their dream. And that dream has been fulfilled today thanks to you. So I would like all the families and friends to stand so that we can honor you. Thank you. And at this time, I would like to invite Michael Clausen to come up and give the invocation.
Good afternoon. Let us pray. Heavenly Father, Creator of all things, we ask your almighty hand to be upon everyone here today. In a few moments, we'll be in the midst of this wonderful occasion, but let us pause briefly to reflect and give thanks on the journey that has brought us all here today. Are reminded of the rich traditions that our students partake in, the stories of the Frontier nurses on horseback, dinner at Wendover, the circle up time, the ringing of the bell at St. Christopher's Chapel, and now the commencement ceremony where it all began in Hyden, Kentucky. These are among the countless number of special memories that will always be cherished. I am quite sure that everyone is very proud of the accomplishments that our graduates have achieved. These men and women have answered the call to make a dramatic difference in all 50 states and several countries around the world. So at this time, I humbly ask that you bless everything that is said and done, including the commencement address, the presentation of the graduates, the pinning ceremony, and all the celebrations that will soon follow. O Lord, may you continue to lead, guide, and direct our graduates as they strive to serve their community by providing the best possible health care with their hands and with their hearts. In this, your precious name I pray, amen.
Thank you, Michael. At this time, I would like to introduce our esteemed chairman of our board, Dr. Michael Carter, who is a friend, a supporter, and a leader for us for the last 15 years. Dr. Carter?
On behalf of the Board of Directors, it's my honor to welcome all of you to this very important ceremony that we partake in today. As we, the board, look at the smiling faces of our soon-to-be graduates, it gives us great drive to continue to build this university. And to all the families, we thank you for sharing your family member with us during this journey. Thank you very much.
Good afternoon. I'm Joni Slager, Dean of Nursing. It's my pleasure this afternoon to introduce one of our most distinguished alumni who's with us to give our commencement address. Holly Powell Kennedy received a diploma in nursing from Miami Valley Hospital School of Nursing, Dayton, Ohio, her bachelor's degree from Chaminade University, Honolulu, Hawaii, her master's degree as a family nurse practitioner from the Medical College of Georgia, her certificate of midwifery from none other than Frontier School of Midwifery and Family Nursing, and her PhD in nursing from the University of Rhode Island. She has held academic positions at the University of Rhode Island and most recently at the University of California, San Francisco. She holds a visiting faculty appointment at King's College London, where she was a Fulbright Distinguished Fellow in 2008. Dr. Kennedy is an internationally known midwifery researcher and leader and is the first person to be appointed as the Varney Professor of Midwifery at Yale in 2009. She came to this position with broad experience as a clinician, researcher, educator, policymaker, and leader in a variety of settings. Collectively, these experiences have shaped her current vision of academic and clinical scholarship in maternal child health care in the United States. She is a past president of the American College of Nurse-Midwives, and in 2016 was awarded the Hattie Henschmeyer Award, which is the highest honor bestowed by the American College of Nurse-Midwife in recognition of her contributions to research, education, and practice. Her research is committed to understanding the links between how care is provided during pregnancy and birth with clinical and social outcomes. Dr. Kennedy received Frontier Nursing University's Alumni Award for Distinguished Service to Society in 2012. Please join me in welcoming Dr. Holly Powell Kennedy.
Thank you. First of all, I would like to congratulate President Stone, Dean Slager, the Board of Directors, the class of 2018, and their faculty who helped them get to this moment, and most of all to the families and supporters who kept the light on while they were out studying or caring for the world. So thank you for this invitation to come and talk with you today. Preparing a graduation address is always a challenge because everyone's eager to see their graduate walk across the stage, and we have a lot of them. Okay. And you don't want to put people to sleep. So I want to tell you a little bit about my journey. You heard a little bit about it, but one of the most important parts of my journey was the Frontier Nursing Service and my education here. So 40 years ago in March in 1978, I drove to the Frontier Nursing Service with two of my family nurse practitioner colleague students from the Medical College of Georgia. We drove in a blinding snowstorm down the Daniel Boone Parkway, as it was known then. And I only remember a little bit about that drive, and mostly that we sang "Only the Good Die Young" at the top of our voices to Billy Joel. We checked into the hotel in Hyden and reluctantly came to grips with the fact that we were in a dry county. The next day, we met with various folks who would decide our fate as interns, and happily we were all accepted and began our 3-month internship with the Frontier Nursing Service. When we arrived, we were housed at Wendover in the barn that had formerly housed horses and now was turned into apartments. I was really sad not to be on horseback, but I did get to ride in Jeeps when we did clinical rounds. We were just a step away from the big house where we took our dinners, and we had sherry in the evening. I was very impressed. And we had an exquisitely thoughtful orientation by two of the staff members who helped us understand the community in which we were living and the importance of Frontier's relationship with Leslie County. We had dinner every night at Wendover, and on Sunday we had roast beef and Yorkshire pudding. I gained 10 pounds in that 3 months. My classmates and I learned a lot that summer. We learned what it was like to work in a community very different from our own. We learned how FNPs and midwives navigated protocols and data collection, and we learned about culture and rural health. We had incredible preceptors and teachers, and that was the summer that this building in which we're standing was named in honor of former President Nixon, and he came for its dedication. That was his first appearance after his resignation. Now, my classmates and I weren't quite sure what to think, but our collective body of people at Frontier said this is what mattered to this community, and it was an honor, and we were able to put that lens on to help us understand that honor, and I'm incredibly honored to be in this gym today. That summer, we learned to spay dogs at Beach Fork because there was no veterinarian in the county. We cared for families in the Mary Breckinridge Hospital, and we grew into our roles as nurse practitioners. Come August, we graduated, and my classmates left. I stayed and worked for a year as a family nurse practitioner, and what an amazing year that was. The people of Leslie County taught me about what was really important: family and connection, and all the joy and the pain that goes along with that. One family in Short Creek invited me into their homes for Sunday dinners, and I've never tasted yeast-raised rolls like that since. Another family invited me into their church to help me understand alternative ways of healing, a searing and humbling memory for me. And that was the year that I learned about midwifery. I had graduated from a diploma school in Ohio, and I had never heard of midwifery. And during my maternity rotation, I was judged on how well I could do a shave, prep, and enema. It wasn't until Christmas of that year that I really began to understand that there was something very different about midwifery and the nurse practitioners that staffed Mary Breckinridge Hospital. The clinical schedule always had one nurse practitioner, me, and one midwife on call in the emergency room at night. As a former Army nurse that worked in the emergency department, that was always my favorite shift, and I have fond memories of those nights. So we were on Christmas night. It was very cold, and nobody had come in until 9 o'clock, and a woman came in with a cardboard box. Now, you might have surmised that from my comment about dogs earlier, that animal care was sometimes in our purview, and there was actually a spot on the encounter form for them, for animal care. The box held a dog and a newborn puppy, and the woman was afraid that there was something wrong because the dog kept laboring. I wasn't a midwife. I said, "It's yours, Kim." And I watched my midwife colleague provide family-centered, holistic, and collaborative care of this family. To this day, I remember all the steps that she took. She consulted with our veterinarian in Lexington over the phone, and he coached her through giving the dog a minuscule amount of Pitocin, which helps contractions, and the dog delivered a puppy. Sadly, it didn't survive, but the mother did, and the other puppy did, and the mother was ecstatic. The mother of the mother dog. It was the most poignant Christmas I've ever experienced as that happy woman left with her dog and puppy. So you may be wondering why I'm telling you these stories. These are what taught me about being a midwife and being a nurse practitioner. I left after a year and went to Vermont and put all that I had learned into action about rural health. However, I had the bug now to be a midwife. And 6 years later, I came back and Frontier took me in to learn those skills. And as they have always done, they helped to creatively tailor my learning to my specific needs. I have loved every minute of clinical practice, of being a midwife, of being a nurse practitioner. And when I decided to pursue doctoral study, I wanted to go back and really understand what I had seen about the clinical practice of midwives here. What made them stand out as something so very different from what I had not seen in other places? So I learned a lot. I learned that they believed in women and their families, that they believed in the normalcy of birth, and they believed that the most important outcome was the given health of the mother and the baby in the given situation. So as you go forward, as newly minted midwives, nurse practitioners, and doctorates, I want you to hold on to 5 lessons that I learned here at Frontier and in the years since in my research. They reflect the foundation that Mary Breckinridge laid so many, many years ago, and they're the key to your future success. First, know the community you serve. Get out there and learn who the people are that you're taking care of. Our work is relationship-based, and that's not just a truism. It really makes a difference. One of the reasons that Mary Breckinridge and the Frontier midwives and nurses were so successful was that they knew the people in this county. When people feel respected, it changes the expression of their stress hormones. It affects cellular change, and it contributes to allostasis, or optimal stress load. Respectful, person-centered care can counteract the systemic impact of institutional racism. Second, be innovative and visionary. Mary Breckinridge was both of these. When I came back to complete my midwifery education in 1984, I remembered hearing these radical ideas about something called CNAP. And look at you. Look what it has become. We were like, really? You wouldn't go to school on the campus? And it is the greatest gift that I believe nursing has been given, that people are able to now study in their community and get such an incredible education. Frontier was founded on a vision to show how skilled, accessible healthcare can make a difference. The health outcomes in Leslie County were startling compared to the rest of the country. The word frontier conjures pioneer. You are a pioneer ripple in the large world that we call our pond. Keep that circle going. Third, be disciplined. From day one, discipline yourself to regularly update your knowledge as a lifelong learner. This is incredibly important. Knowledge is developing and disseminating all the time, and you need to keep up with it. Keep your practice statistics. I don't care if the practices that you go into are keeping their own. You want to keep your statistics. You want to know how many people you're seeing a day, a month, a year, how long it takes. You want to know their outcomes. This is not only important for the future health and research around the work that we do, it could also save your job. Mary Breckenridge brought that back from the UK, who are masters at doing that. So in the words of D.H. Lawrence, in terms of lifelong learning, the eyes don't see what the mind doesn't know, so always question. Fourth, believe in the people for whom you care. Respect their knowledge of themselves, believe in the normalcy of birth and life cycles, and do all that you can do to support them. They are the joy in our work. And finally, take care of yourself and your family. You must take care of your own health and all its dimensions in order to effectively care for others. So remember, your future work is not only a reflection on you, but also on Frontier Nursing University. Keep making us proud. Congratulations and good luck, and I wish you the best.
Thank you so much, Holly. Now I want to introduce our very own Kitty Ernst. And I would say that the graduates know Kitty and the faculty know Kitty. Maybe your friends and family don't all know what a brilliant genius this woman is. She is the person who designed this distance learning process and launched it back in 1989. And we are all indebted to her for her persistence and her vision to do this. But now, Kitty wants to talk to you. They're getting that box for you. Whoop. Back off 1 minute, Kitty.
What, I got 3 of them here. Gee.
Don't back off.
Well, that's a confession that I am shrinking. I'm to greet you all, and I bring you from the alumni mountains of congratulations and Godspeed in your chosen work to improve health care for all of the childbearing women and families in the communities in which you serve. You stand on the broad shoulders of Mary Breckenridge, who demonstrated a remarkable system. Imagine, system, almost 100 years ago. We don't have anything like it right now. A system of care here in what was then one of the most remote and challenging areas of the United States. The first analysis of the data she collected of the most remote area on the work of the Frontier Nursing Service was analyzed and reported by the Metropolitan Life Insurance Company in 1930. And that said, if this model of care was replicated across the nation, the lives of 30,000 mothers and 30,000 babies would be saved annually. There is now 90 years of research on nurse midwifery and family health care that reports the same safe, satisfying care, and equally important at half the cost. When I graduated from Frontiers 67 years ago, there were only 6 students in my class, and most of them, except for those of us that signed on to work here at Frontier, were headed abroad to the mission fields around the world. Frontier today has broken down the many barriers to expanding both the education and the practice faced by too many years, especially by the nurse-midwives. To better meet the needs of the mountain people, Frontier then established the first family nurse practitioner program. Then, by taking a leap into the age of technology, the first successful distance midwifery education program for nurses. But Frontier has not stopped there. In its commitment to educate nurse practitioners to meet the emerging complex and changing needs of the people being served, a variety of programs are underway and they continue to be developed. Now, I know that all of you are aware of what the media is shouting these days, that our healthcare delivery system, if one could call it that, is in crisis. It is not meeting the needs of the people being served, let alone all the people who need to be served. You can help make that better. Remember that the one difference between us and the other developed countries with better outcomes for mothers and babies at lower cost is that they have always had midwives. They've always had midwives. You're supposed to applaud on that. Thank you. So the only advice I have for you was given to me recently when I faced an adverse life situation. It comes from one of our most illustrious alumni, the president of your university. And it's so on target, I wanted to share it with you because it's not rocket science, it's quite simple, and it may help you as you face adversities in your professional life. First, ask yourself, what is the problem you need to solve? It is a familiar question, for it is used every day in clinical practice. You cannot solve a problem if you don't have a diagnosis, and you don't have a diagnosis if you haven't identified and defined all the aspects of the problem. As clinicians, you call it root cause analysis. Second, what is the strategy for solving it, and how will it be funded? You know that I would always add that because I tell you from day one to follow the money. Even when you have defined the problem, you rarely can solve it alone or without a plan and need assistance. Lastly, I have a personal request. At Frontier, you have been taught that you cannot do everything, or maybe even anything, alone. So join your alumni association and your professional organizations and any other organizations that are supporting the changes you're trying to make. This unity will better enable you to be informed about what is going on outside of your tiny sphere of operation. And that will enable you to be part of the solution for establishing a kinder and more affordable system of health care for all. Congratulations to every single one of you for the achievement we celebrate here with you today. Oh, I forgot. No, wait. All right, anyway. Dr. Nicholson is going to share a few words with you, too, that I want you to listen to. But she does it in song, and it's much nicer.
When I was a child, I could see the wind in the trees, and I heard a song in the breeze. It was there singing out my name, but I'm not a girl. I have known a taste of defeat, and I finally grown to believe it will all come around again. And though I may not know the answers, I can finally say I'm free. If the questions let me hear them, I am who I was born to be. And so here am I, open arms and ready to stand. I've got the world in my hands, and it feels like my turn to fly. And though I may not know the answers, I can finally say I'm free. If the questions let me hear them, I am who I was born to be. When I was a child, there were flowers that bloomed in the night, unafraid to take in the light, unashamed to have braved the dark. Though I may not know the answers, I can finally say I'm free. If the questions let me hear them, I am who I was born
Now I would like to invite Dr. Ann Cockrum, who is our Associate Dean for Academic Affairs, who will be doing some graduate recognitions. Ann?
Good afternoon, everyone. Right now, we'd like to recognize a number of groups of students for their important contributions to our community. So we'd like student council representatives to stand and be recognized. Thank you. Next, we'd like to invite Diversity and Inclusion Pride members to stand and be recognized. Thank you. Next, Sigma Theta Tau International Honor Society members. Next, military service and veterans. Thank you. And lastly, wide neighborhood ambassadors. Thank you all very much.
At this time, Dr. Deborah Karsnitz, who's chair of the Scholarship Committee, will come forward and recognize our scholarship recipients.
I am very pleased to say that this year in 2018, Frontier Nursing University had $500,000 in federal grants and was able to award nearly 300 students. In addition, through the generous donors for our private foundation, we were able to award nearly 100 other students over $150,000. Would all those students that received scholarship please stand to be recognized? Thank you.
So all of the students at Frontier Nursing University are leaders. We have some special recognition of some very special leaders. The first is the 2018 Leadership Award for the CNEP, or midwife students, named after our own Kitty Ernst. The 2018 Kitty Ernst Award recipient is Debbie Alba. Debbie's primary interests include rural health and breastfeeding. Debbie developed relationships with the leaders in her community, working with them on activities which build on the strengths and needs of the community, including the building of a senior center, which provided a gathering space for older residents in the community. She was the program director with Strengthening Rural Families, an organization focusing on parenting education, working in collaboration with the school district. She had been a member of the school district's curriculum committee and is a member of the superintendent's advisory committee. As a public health nurse for her local county health department, Debbie increased programming for mental health services for pregnant and postpartum teens and high-risk women. She worked as a lactation services coordinator at a regional medical center and received funding and support for a donor milk depot and initiated the use of donor milk on the floor and led a team of nurses to implement uninterrupted skin-to-skin time between mothers and babies at birth. She has been the co-president of the Oregon Lactation Association and the Western Regional Chair of the United States Breastfeeding Coalition. In her new position as a certified nurse midwife in a freestanding birth center, Kitty, she hopes to create a comprehensive program for lactation and postpartum support. Is Debbie here? Okay. All right. The next is the Nurse Practitioner Leadership Award. And this awardee is Bree Farron. Bree Farron is originally from Vancouver, Canada, but received her bachelor's in entertainment technology from New York City College of Technology. After working on Broadway, she received her associate's degree from Phillips Beth Israel School of Nursing. She has worked in an emergency department in New York, a TB ward in Haiti, an Ebola treatment unit in Sierra Leone, and at Planned Parenthood, New York City. As the student leader of the Nurses for Sexual and Reproductive Health chapter for Frontier Nursing students and alumni, she has planned trainings in transgender healthcare and trauma-informed care. Bree is the student liaison to the American Public Health Association's Sexual and Reproductive Health section and a member of the New York State Board of the International Association of Forensic Nurses. Bree is pursuing her Doctor of Nursing practice at Frontier and is a family nurse practitioner on the mobile medical unit operated by Planned Parenthood New York City, providing care to underserved neighborhoods and communities. In addition to preventive care, Bree is providing sexual, reproductive, transgender health, and HIV screening and treatment for individuals experiencing homelessness, substance abuse, and criminal justice involvement. Now for the DNPs. The Doctor of Nursing Practice Leadership Award recipient in 2018 is Dr. Jeanette Bowers. Dr. Bowers began her nursing career at the age of 15 as a CNA, that's a nurse assistant, at her hometown nursing home. Dr. Bowers obtained her ASN, BSN, and MSN and her family nurse practitioner at Purdue University. She has worked in a variety of settings, including emergency medicine, critical care, cardiovascular surgery, and HIV/AIDS care. While in Indiana, she was the director of a newly established pain clinic and later director of cardiovascular services in a level 2 trauma center. She collaborated with a local physician to open and manage a clinic designed to offer free health care to poor rural residents. She led a subcommittee of the Coalition of Advanced Practice Nurses of Indiana, which was responsible for delivering educational opportunities to APRNs. Dr. Bowers received her certification as an HIV specialist from the American Academy of HIV Medicine in 2017. Her direct clinical care is focused on the care of HIV-positive patients on the island of St. Croix in the U.S. Virgin Islands, and she has been instrumental in the development of a homeless outreach program. She's the only provider in the territory certified as an HIV specialist. She authored a bill designed to give full practice authority to APRNs in the U.S. Virgin Islands, and as a result was recognized as the 2016 Nurse Practitioner of the Year. Her future goals include in educating young women and men on the art of nursing and establishing a graduate nursing program at the University of the Virgin Islands. Come on up. I just heard a rumor that Bree Farron is in the house. Is that true? Thank you. You didn't know we were going to make you come up on stage, did you? All right, this last award, and this is a fun one because this award recipient doesn't know that she is receiving an award. And this is the very first time that we've given an award for the Exemplar DNP, or Doctor of Nursing Practice Project. Among the competencies of the Doctor of Nursing Practice clinical leader is the ability to translate evidence into clinical practice with the goal of improving healthcare quality. The 2018 inaugural DNP Project Exemplar Award is being awarded to a graduate who exemplified clinical scholarship and team building, creativity in the planning and implementation of a quality improvement initiative focusing on improving communication. Communication breakdown among the healthcare teams is known to be the cause of unnecessary death and long-term illness in the United States and worldwide. Now, all students at Frontier can relate to the stress of having their internet go down in the middle of a presentation, having too many kids on the network during primetime live Big Blue Button teaching sessions. But few have had to effectively navigate internet access out of the country. Dr. Anna Verzoni made certain she got herself to the best internet possible for planned hangouts without a hitch. This meant that an entire inn had to ask their guests to stay off the internet for 2 hours. Now that takes leadership. For her project, Anna led an interprofessional team of 34 providers and staff members to use advanced standardized verbal handoff during 115 incoming transfers from 18 outpatient clinics to a regional tertiary care center in the Kaveri district of Nepal's Kathmandu Valley, which serves over 1.9 million people. Soon after implementation of her project, it became quickly apparent that the emergency transport tool, and we are familiar with that as SBAR, she had planned to use this tool was culturally irrelevant, and her skills as a navigator and co-creator were put to the test. She gathered groups of people, listened to their feedback, pilot tested, tweaked, and listened to people again, and this is what it takes to create change in the healthcare system today. Every one of our DNP graduates sitting here today has moved mountains, leading a team through a complex healthcare environment. Frontier's chosen this exemplary project for its creativity, cultural humility, vision, and impact. Dr. Verzone has been working with rural populations since 2004. She is a certified family nurse practitioner and certified nurse midwife, and she currently lives in Alaska, where she works for the Rural Anchorage Service Unit at the Alaska Native Medical Center, providing primary, urgent, and emergency care in rural Alaskan Native villages. We are very lucky because she's now a member of the Frontier faculty. So congratulations, Dr. Anna Verzoni. I'm not sure which one of us is more choked up. Yes, sorry. Okay, I would like to now ask Nicole Serrano to come forward, and Nicole is going to hand out some very special awards. These are the Student Choice Awards, so the students selected the winners of these awards.
Hi everyone, and thank you for coming. I'm a student council representative, and I'm here to present these awards on behalf of the student body. Every year we put out a survey to try to nominate and select faculty who has been instrumental in our work as students at Frontier University, and we have 2 awards to present today. Both of them essentially go along with the quality of teaching that we have been so lucky to have here at Frontier. And we just have 2 different selections, so one for the didactic faculty as well as one for regional clinical faculty, or RCFs. So I'll start with Dr. Keefe, who's the didactic faculty winner for our Choice Awards. So come on up. So to give you a student quote, Dr. Keefe changed how I feel about statistics. She is knowledgeable, patient, and loves to teach, and it shows. So thank you for all of your hard work and dedication to us. And the next is Dr. Cave. Dr. Cave has always been prompt with responses and is very informative, and a lot of students couldn't have done it without her, and that is the RCF. Thank you.
And we've come to a very special time in our program. Today we are going to be awarding Edith Baldwin-Wannell the Doctor of Humane Letters. And before we do that, I would like to tell you a little bit about Edith. The story of nurse midwife Edith Baldwin-Wannell demonstrates the importance of applying relationship, resilience, and reflection to pioneering change. Edie's story reveals 2 of the most basic characteristics of all successful leaders. That's passion for their work and a willingness to take calculated risks. When Edie began her work, she had the wisdom and vision to see that all childbearing women were being underserved. She answered her call to nursing and midwifery by establishing a comprehensive family-centered maternity service in the 1960s and 2 freestanding birthing centers later on. Her story began in Woodbridge, Connecticut, where she grew up on a farm. Her father was a state senator and chairman of the New England Republican Party in the years following World War II. Edie was educated in nursing at Skidmore College and in midwifery in one of the first classes of Columbia University. She first worked as a nurse midwife on the home birth service of Maternity Center Association. In 1961, Edie married Jim Wannell and relocated to Pennsylvania. There, as Edie began her family, which she turned out to have 4 wonderful children, she was recruited by a group of mothers to establish one of Philadelphia's first childbirth education programs. The participants met in weekly evening classes in a church basement, laying the foundation for the activist women to proceed on to establish the Philadelphia Childbirth Education Association. In 1967, Edie was recruited by the Wilmington Medical Center to establish their groundbreaking childbirth education and family-centered maternity care services. Edie's entrepreneurial drive led her to open the Bryn Mawr Birth Center in 1978 and the Birthing Center in Wilmington, Delaware in 1982. Today, both birth centers operate at full capacity. Simply put, she developed the entrepreneurial model that has played a major role in offering alternatives for women. A debt of gratitude is owed to Edie for her participation in national research on birth centers. Edie's never-ending contributions in voluntary service on boards and committees of the American College Nurse-Midwives, the American Association of Birth Centers, and the Commission for the Accreditation of Birth Centers provide an extraordinary role model of selfless service. But most of all, Edith Wannell pioneered and beautifully modeled the mission of Frontier Nursing University, which states in part to educate nurses to become competent, entrepreneurial, ethical, and compassionate nurse midwives and nurse practitioners who are leaders in the primary care of women and families. Today, we are honored to present Edith Baldwin Wannell, the Doctor of Humane Letters, for her extraordinary lifelong dedication to the profession. Edie? Now I'd like to invite Edie's daughter, Dr. Diane Shannon, who would like to share some thoughts about her mother.
I vividly remember the first birth I saw. I'd seen many births in movies, actually from a very young age when my sister Amy and I would sit in the back of the room with coloring books while my mother taught childbirth education classes. No, I mean the first live birth. I was a medical student home during the summer between my first and second years. My mother asked me if I would be interested in videotaping some births for some of the families at the birth center. And this was the birth center of Delaware. I jumped at the chance. The night of that first birth, she knocks on my door in the wee hours. As I struggle to wake up and remember where I am, she says, "It's their second pregnancy. We need to move along." We arrive at the birth center just a few minutes before the couple does. For the next few hours, I help out by getting ice chips and clean towels, and I watch my mother. She is warm, respectful, and present, and the couple responds to her calm demeanor. Together, they work, coached by my mother, through each contraction until the birth. My mother gives me the signal to turn on the video camera, and I watch through the lens, silent and so moved. Soon their daughter is born, slipping out onto the bed easily, and then placed on her mother's chest, where her father pats her dry with a towel. They name her Rose. That night, I saw two miracles. The first was the miracle of birth. The second was the miracle of my mother's gifts. She engendered calm confidence. She exuded this sense of trust. And she created a bond that allowed that woman to tap into her power during labor and delivery. That experience was worlds away from the births that I would eventually witness as a third-year medical student on my obstetrics rotation. And that night was no exception. My mother helped hundreds and hundreds of families to have amazing, bonding birth experiences. President Stone, honored guests, faculty, graduates, I am so honored to be here today to accept on behalf of my mother this prestigious award, an honorary doctorate from Frontier Nursing University. I'm especially grateful to the university for marking in such a permanent and visible way the amazing accomplishments of my mother in serving the women and families that she helped for 50 years. Graduates, today I would like to share with you 3 lessons that I learned from my mother, lessons that I believe will serve you well as you continue your journey as healers. First, find a career where you make a positive difference in the world and tap into your passion. My mother loved her work, and it showed. I could see the deep satisfaction she felt in serving to make the world a better place, one woman, one family at a time. Passion is like rocket fuel. It gives you that energy to keep going. Lesson number 2. Don't be afraid to take reasonable risks in service of your mission. In 1985, there was a liability insurance crisis in this country, and midwives, obstetricians, and birth centers had a great deal of difficulty finding malpractice insurance. The birth center board of directors wanted to close the center, but instead, my mother, because she owned the property and leased it to the center, decided to make a change. And she incorporated as a private practice and then went without insurance for herself or the center so she could keep serving women and families until insurance could be obtained. Lesson number 3, if you find an obstacle in your path, don't be dismayed. Find a way around it. In the mid-60s, my mother was recruited by Wilmington Medical Center to develop their childbirth education program and their family-centered care program. A few years later, after she developed the program, she was fired for complex reasons, but in my opinion, because she believed that the traditions were not serving families well. She lost her job. Did she give up? No. Recognizing the growing need for alternatives to the medical model, instead she went back to her original calling as a nurse midwife. She went back for a refresher course at Booth Maternity Center and worked at Planned Parenthood to upgrade her GYN skills. Then she purchased and renovated a building a few blocks away from the Bryn Mawr Hospital and began with others the first independent birth center in the state of Pennsylvania. She did not give up. What do these 3 lessons have in common? It's resilience. Because my mother loved her work and knew what family-centered care would do for women, she would not be defeated. Frontier Nursing University was founded because our healthcare system was not serving pregnant women and families with evidence-based care. Our healthcare system today is even more complicated, and nursing has always been the backbone of care delivery in this country. We desperately need caring, smart, dedicated health professionals like you if we're ever to achieve our goal of high quality, affordable care for everyone. I thank you on behalf of my mother for continuing her work, the important work of empowering the people you serve and creating strong communities. Tap into your passion. Don't be afraid to take reasonable risks. And if you find an obstacle in your path, look for a way around it. There is much work to be done. You will Every single one of you make a difference. Congratulations and good luck.
Thank you so much, Diane, and congratulations, Edie. We are absolutely honored. Okay, now it's time to graduate. I'd like to invite Dr. Carter up and to confirm the graduates. Dr. Carter, on behalf of Frontier Nursing University, I am pleased and honored to present these candidates for the degrees Doctor of Nursing Practice and Master of Science in Nursing and postmaster certificates as nurse midwife and nurse practitioner. These students have fulfilled the academic and clinical requirements for their degrees and are now prepared to practice the profession of nursing as nurse midwives, family nurse practitioners, and women's health care nurse practitioners.
Will the graduates please rise? President Stone, on behalf of the Board of Directors of Frontier Nursing University, I accept for confirmation these candidates for their respective degrees and certificates, and we, the board, wish to express our hope and challenge that your work as graduates of this august university will promote the health and wellness of all people in the vision of Mary Breckinridge to care for mothers and babies and the families who care for them. The noted author Alex Haley used to have a number of rather cute anecdotes he would share. And one was, anytime that you see a turtle on a fence post, that turtle had some help. Each of you today is that turtle. So along with you, I ask all family members, aunts, uncles, grandparents, spouses, children, and the three people who thought we were having a party in here, please stand as I confer the degrees. This is your degree as well as the graduate's degrees. Please stand. Now, by the authority of the Commonwealth of Kentucky, invested in the Board of Directors at Frontier Nursing University, and by them delegated to me, I do, on the nomination of the faculty, grant and confer upon you the degrees and certificates for which you have been presented, and confer on you all the honors, rights, and privileges to them appertaining. Congratulations.
Now presenting the candidates for Doctor of Nursing Practice.
Graduates who you can see in the back, if you would like to sit down, feel free. And the families, of course, too. Yes.
Dr. Grace Carey Jones. Her project, efficiently improve preventive care for inflammatory bowel disease patients utilizing American College of Gastroenterology guidelines. Dr. Kaoku Okolani Laduza. Her project, implementation of a safety bundle to improve effective maternal mental health care in an obstetric setting. Dr. Marianne Thomas. Her project, increasing effective breast and cervical cancer screening and management in rural Washington. Dr. Barbara Gummery. Her project, increasing effective care for sexually active patients presenting to urgent care through screening for sexuality transmitted infection. Dr. Lindsay Lachant. Her project, implementing effective perinatal breastfeeding care at an urban midwifery-led practice. Dr. Jeanette Bowers. Her project, improving effectiveness of care to patients infected with human immunodeficiency through risk screening and counseling for high-risk behaviors. Dr. Marissa Callender. Her project, increasing patient-centered care using the ACNM's Comfort in Labor bundle. Dr. Jennifer Boucher. Her project, effective use of portions of the QCC obstetric hemorrhage toolkit to improve hospital preparedness for postpartum hemorrhage. Dr. Kristen Hayward. Her project, improving weight management, patient-centered care, utilizing a self-management goal worksheet. Dr. Jenny Lash. Her project, a safe decrease in the primary CS rate by utilizing the Florida Perinatal Quality Collaborative Toolkit. Dr. Amy Lee Manning. Her project, implementing timely cervical cancer screening efforts in a rural family practice setting. Dr. Erica Wright. Her project, increase effective and appropriate screening, brief intervention, referral to treatment, SBIRTH, for pediatric patients ages 0 to 5 at Matsu Midwifery and Family Health. Dr. Yigan Annie Jamalan. Her project, patient-centered care in a suburban-free clinic utilizing national quality forum culture complacency. Dr. Rebecca Simmons. Her project, improving quality of life, a resident-centered approach using Alzheimer's Association Dementia Care Practice Recommendations 2018. Dr. Adriana Smith. Her project, improving patient-centered care and system efficiency in home health setting. Dr. Sarah Jenick. Her project, improving patient-centered care for adults with metabolic syndrome using Adult Treatment Panel 3 guidelines. Dr. Susanna Caroline Phillips. Her project, effective management of hypertension based on the ACC AHA guidelines in the primary care setting. Dr. Lisa Kaiser. Her project, improving equitable access to cervical cancer screening and management in an urban, federally qualified health center. Dr. Alicia Fields. Her project, improving efficiency of self-monitoring blood glucose reporting among patients with type 2 diabetes via telecommunication. Dr. Brandy Lee Ballantyne. Her project, implementing a staying safe toolkit to improve safety in adults with dementia. Dr. Nina Booth. Her project, improving access and standardizing patient-centered palliative care for advanced cancer patients. Dr. Carrie Dunaway. Her project, improving safety of atrial fibrillation patients through stroke prophylactics, utilizing CHAD VASC risk tool for standardizing anticoagulation. Dr. Derek Maniz-Calgo. His project, effective tobacco care, implementing tobacco use guidelines in urgent care setting. Dr. Joy Brock. Her project, improving timely and effective care for long-term acute care patients at Barlow Respiratory Hospital. Dr. Alan Long. His project, increase the identification and management of patients at risk for prediabetes at the Health and Wellness Clinic. Dr. Vicki C. Scott. Her project, timely detection of risk for diabetes in Native Americans visiting a women's health clinic. Dr. Deborah Wainwright. Her project, improving screening and management of female sexual dysfunction, a patient-centered approach at a national center. Dr. David Kuntz. His project, increased patient-centered management of patients in primary using JNC8 guidelines. Dr. Ruth Millian-Jonasis. Her project, diabetes in primary care, improving patient screening, compliance, and clinical outcomes using the screening brief, intervention, and referral to treatment model. Dr. Damaris Mose. Her project, implementing a palliative care screening tool to improve efficiency of identification, referral, and management in a skilled nursing facility. Dr. Cynthia Armstrong. Her project, improving postpartum patient-centered right care, utilizing the postpartum care basics for maternity safety bundle. Dr. Bradley Marzek. His project, increasing safe prescribing through efficient screening of chronic pain patients in an outpatient setting, utilizing the CDC guideline for prescribing opioids for chronic pain. Dr. Nicole Serrano. Her project, efficient lipoid management according to the American College of Cardiology, American Heart Association guidelines in a primary care clinic. Dr. Audrey Usuri. Effective use of antibiotic stewardship with a National Quality Partners Playbook in suburban outpatient care clinic. Dr. Heidi Bickford. Her project, screening brief intervention, referral to the treatment, effectively engaging substance using patient at a federally qualified health center. Dr. Rebecca Wegschel. Her project, patient-centered sexual health care for sexual minority clients at a federally qualified health center. Dr. Deborah Arndt. Her project, improving timely diagnosis and treatment of perinatal depression in the office setting, implementation of the ACOG screening for perinatal depression guidelines. Dr. Jean Lithgow. Her project, implementation of a transfusion risk assessment tool to effectively reduce blood transfusions in cardiac surgery patients. Dr. Stephanie M. Dove. Her project, improving post-operative patient-centered right care utilizing a pain management bundle. Dr. Amy Catherine Rohr. Her project, increasing timely collateral cancer screening using a shared decision-making tool at an urban FQHC. Dr. Dana Catherine Velzi. Her project, achieving centered care utilizing shared decision-making and screening tools for prenatal geriatric screening, genetic screening. Dr. Catherine Gramlich. Her project, improving diabetic foot care in a primary care practice, a patient-centered quality improvement project. Dr. Amanda Dunham. Her project, improving health hypertension care by utilizing risk calculation and target BP primary care. Dr. Alicia Trey. Her project, utilizing standardized processes and patient-centered care to improve vaccination rates among at-risk adults. Dr. Dana Tuari. Her project, improving appropriate VTE in hospitalization patients. Dr. Kevin Brunassini. His project, implementation of a virtual patient-centered weight loss maintenance behavior competency assessment in adults with obesity. Dr. Christopher Kennedy. His project, providing effective asthma care utilizing a standardized approach at a pediatric patient-centered medical home. Dr. Sharonda Pfeiffer. Her project, increasing effective gonorrhea screening and follow-up care in an urban family planning clinic utilizing USPSTF guidelines. Dr. David Foisey. His project, implementation of a standardized guidelines to provide timely care with intracranial hemorrhage patients in the intensive care units. Dr. Chad Hott. His project, implementing SBIRTH in a rural FQHC using DAS-T10 and NAITX to provide patient-centered addiction care. Dr. Anna Verzoni. Her project, improving efficiency during transport from rural clinics to emergency departments with standardized communication. Dr. Gabrielle Sander. Her project, enhancing patient-centered care in a mobile clinic using Bright Futures guidelines. Dr. Summer Park. Her project, improving timely annual ocular examinations for patients with DM in a primary care office. Dr. Azam Tayyebi. Her project, improving timely vascular referrals by implementing lower extremity amputation prevention LEAP tool. Dr. Tarnia Newton. Her project, a patient-centered approach to improving standardized preventive diabetic care in a San Antonio nurse practitioner-led clinic. Dr. Carrie Troggett. Her project, adult depression screening at a suburban ambulatory center, treatment using screening, brief intervention, and referral to treatment. Dr. April Marshall. Her project, implementation of a patient-centered trauma-informed care in a rural hospital emergency department. Dr. Latrice Martin. Her project, effectiveness of a reproductive life plan for reproductive age women in a primary care setting. Dr. Karen Vandervelde. Her project, increasing screening and treatment of perinatal depression at a low-volume community birth center. Dr. Megan Danielson. Her project, increasing the effective and appropriate use of intermittent oscillation to decrease the NTSV cesarean rates. Dr. Dorsina Gale. Her project, implementing effective screening and refers to treatment for substance use among pregnant women in a treatment OB clinic. Dr. Donna Forbes. Her project, increasing efficiency in an outpatient clinic by implementing American Medical Association steps forward, pre-visit checklists, and huddles. Dr. Tracy Watkins. Her project, implementing the 5 A's decision tool to improve patient-centered weight management in primary care. Dr. Cheryl Denise Scoff. Her project, effective self-screening of pregnant women for gestational diabetes at rural CN clinic. Now presenting the candidates for Certified Nurse Midwife. Marianne Taylor Atoll. Kirsten Code. Sarah Schlageter. Sarah Schultz. Emily Thrower. Desiree Michaelisco. Caroline Peacock. Rachel Clark. Crystal LaJoya Wilkins. Fabiola S. Garza. Onidas Lopez. Essence Williams. Kelly Chapman. Mari Wiles. Sarah Rumbaugh. Brandy Pierce. Naila Edwards. Lynn Ehrman. Tandra Hudson. Erica Nemhard Samuels. Courtney Duffy. Catherine Fry. Ellis Greer. Kayla Pomp Stewart. Wendy Wakestraw. Brittany Chrislip. Anna Medeiros. Cynthia Jefferson. Tracy Huff. Whitney Clark. Cassie Sefton. Eniko Sali. Stephanie Schwartz. Sarah Kohal. Joy McElye. Julia Elizabeth Delval. Karen Petrusik McNeil. Siobhan Renee Gray. Jessica Travis. Aleda Elliott. Amy White. Regina Chandler. Susan Hensley. Virginia Clifford. Joni Sands. Felicia Washington Brown. Emily Livingston Luna. Melissa Zinn. Margaret Petrie. Elizabeth Shireman. Jennifer McKay. Lauren Cox. Nicole Schwantz. Jody Morse. Julie Irvine. Stephanie Gentry Martinez. Accepting for Christy Warren is Jimmy Jones. Ajua Asuma Nkrumah. Britt Solomon. Nicole Gress. Sharon Ann Wallace. Michelle Almeida Santos Hansen. Tessa Stamba. Alora Haynes. Christina Van Dusen. Sarah Krajewski. Haley Smith. Catherine Hennessy Carter. Catherine Tyson. Lilith Bulgim Sarkisian. Chandra Case. Tiffany Janae Briggs. Eleanor Colmenares. Kimberly Plummer Wallace. So now announcing candidates for Women's Healthcare Nurse Practitioner, Casey Bays Paxton. Announcing for Psychiatric Mental Health Nurse Practitioner, Dr. Kimberly Brown. Stuart Christopher Vickery. Now announcing the candidates for Family Nurse Practitioner, Brittany Arrowwood. Jennifer Elaine Stanley. Emily Heidi Ha. Morgan Gieske. Tammy Vasquez. Barbara and Reimer. Brandy Pelfrey. Tristan Murray. Krista Marie Hobson. Brandy Buckaloo Merchant. Brandy Robertson. Angela Kern. Lauren Alexandra Dillman. Rihanna Hargrove. Laura Krall. Mihaela Suliopolis. Rachel Lee Mitchell. Nicholas Kyle Shockley. Fran Sutton. Joyce Ann Parker. Shelley Truey. Julie Ann Jarsma. Bree Farron. Lillian Shira. Nikichi Niera Oranason. Kirsten Howell. Miranda Jordan. Timber Jackson. Betty Kelly Fugit. Sonia Suttle. Katie O'Connor. Takia Desiree Watts. Tara Cruz. Nicole Lee Kataya. Jennifer Cooper Wyrick. Andrea Leanne Tiffin. Lauren Brennan. Courtney Tutt. Jessica Brantley. Shannon Anderson. Kristen Karkner. Jennifer Lang Cook. Jeremy Matthew Morgan. Now announcing candidates came from the Bridge program. Michelle Bacon, family nurse practitioner. Marianne Chrisman, family nurse practitioner. Brooke Lindsay Bambridge, family nurse practitioner. Valerie Job, family nurse practitioner. Sarah Michelle McGuire, nurse midwife. Kim McConnell, nurse midwife. Matthew Evans, family nurse practitioner. Jennifer Erin Schultes, family nurse practitioner. Sherry Ann Hill, family nurse practitioner. Kelly McAdam, nurse midwife. Kelly Christine DeGroat, family nurse practitioner. Wendy Blair Harrod, family nurse practitioner. Megan Allison Williams, family nurse practitioner. Blake Smith, family nurse practitioner. Donna Elizabeth Frazier, family nurse practitioner. Anita Reyes, family nurse practitioner. Jeremy Hollingshead, family nurse practitioner. Candy Joe Hollerman, family nurse practitioner. Chris Koravu, family nurse practitioner. Michelle Holzman, nurse midwife. Crystal Kyle Upton, nurse midwife. Stacy Hogue, family nurse practitioner. Catherine Cornett, family nurse practitioner. Cindy Nicole Maynard, family nurse practitioner. Jenny Nicole Gard, family nurse practitioner. Laura Michelle Taylor, family nurse practitioner. Leanne Smith, nurse midwife. Julie Danley, nurse midwife. Stephanie Anderson, family nurse practitioner. Haven Hawk, family nurse practitioner. Marcy Ellington, family nurse practitioner. Samantha Roberts, family nurse practitioner. Carrie Young, nurse midwife. Sarah McGrell, nurse midwife. Sherry Gray, family nurse practitioner. Nancy Diane Carter, family nurse practitioner. Skylar Napier, family nurse practitioner. Amanda Varney, family nurse practitioner. Megan Floyd, nurse midwife. Sherry Camerata, nurse midwife. Andrew Yeomans, nurse midwife. Corianne Parada, nurse midwife. Kristen Klein, nurse midwife. Angela Kipp, family nurse practitioner. Elizabeth Reinhold, nurse midwife. Heidi Carter, nurse midwife.
Does somebody out there want the microphone or something? Congratulations, graduates. MSN students, will you move your tassel from one side to the other? Okay, now we're going to do one of our tradition things, and all of you know how we like to circle up. This is going to be a tiny bit of a complicated circle up, so I want you to listen to me, okay? But it's going to be really fun. So what's going to happen is we're going to don't do anything yet. The students will all circle up first, and Tanya Nicholson and Lisa Chappell will lead you, and you will circle all the way around the gym in an outward-facing circle. For the rest of you, for us, a circle up is a time of reflection, union, and it's an honored tradition as part of our campus experience here at Frontier. After our students circle up, our faculty will circle around you on the outside facing into you. And then we will have the pinning ceremony. I would like to ask the audience to stay seated until we're done with this. This really won't take too much longer. I know you're getting tired. But we'll do the pinning ceremony, and then after that, we'll ask you to have a reception with us up in the upstairs, and we will welcome our students into the profession. Oh, no. But first, we will have the video. This is another tradition of ours. It's about a 5-minute video, so. I think we need to get off the stage. Yeah. Michael, we don't have the meeting.
It's inevitable. It's in every one of us. I just remembered. It's like I've been sleeping for years. I'm not awake as I can be, but my seeing's better. I can see through the tears. I've been realizing that I bought this ticket and watching only half of the show. But there is scenery and lights and a cast of thousands who won't know what I know. And it's good that it's so. It's in every one of us to be wise. Find your heart, open up both your eyes. We can all know everything without ever knowing why. It's in every one of us, by and by. It's in every one of us, by and by.
This is one of the amazing talents of Frontier student, faculty, and staff, how quickly we can make a circle. Tanya. I'm going to wait till after. Guys, we're kind of running out of room, so faculty, if you would step back, we will double circle the students. Faculty, step back. Students, step back with your faculty and leave room for another row of students. We're Frontier, we can adapt, we can make this work. You all right? You tell me when. Now? Okay, graduates and faculty. Faculty, pin your first row of graduates, not students anymore. And graduate, after you are pinned, step back and let your colleague behind you step forward. But don't go anywhere. Where are they? Are they taking pictures of this? It's incredible. Like, where are they? Okay, everybody, has everybody been pinned? Faculty, give me a clue. Okay, I want you to welcome the graduates into the profession. Faculty, please welcome the graduates into the profession.
We're going to sing the school song, and then graduates, remember that we have, for you and your families, a reception upstairs. Faculty, please remain down here so that we can get a faculty photo. So join with me. And therefore we have come to join hands and hearts together to give gentle care to families. United we learn. For the babies and for the mothers, the fathers and for the brothers, the sisters and all the others, we come here to learn. And when we have completed this task that we have before us, our culture of caring will circle the globe. And double circle the Nixon Center.
Congratulations, everybody. Congratulations, graduates, families, faculty. We're so proud of you. So everybody, we're going to be removing the chairs, and we're going to have refreshments served upstairs and downstairs, starting upstairs, and then we'll have some tables down here for bringing refreshments down, and we're going to have some bluegrass music here, too. Faculty, please don't forget we need a faculty picture before you leave and before you take off your regalia. Last of all, there has been a blue phone found, and it's at the front desk. Yeah,